Okay, so right now, as you're sitting there, there's this incredible invisible battle happening inside your body. It's a fight against acid, and winning it, second by second, is absolutely essential for survival. So how on earth does your body pull this off? Well, let's dive in.
So that's the big question, right? How does your body handle this constant production of acid without, just breaking down? The answer is pretty amazing, and it involves two very different, very specialized champions of balance.
And here they are. Meet our two key players. On one side, you've got the lungs, and you can think of them as the sprinter. They react in minutes, super fast, immediate defense. And on the other side, you've got the kidneys. They're the marathon runners. They're slower, for sure, taking hours or even days to really get going, but their work is incredibly powerful and built for the long haul.
Now, before we see our sprinter and our marathon runner in action, we've got to get one thing straight. Producing acid isn't some kind of disease or problem. It's just a normal, everyday part of being alive. The real trick is managing it all.
Think about it like this. Every single cell in your body is like a tiny engine. As it burns fuel to give you energy, it creates acidic byproducts. It's kind of like the exhaust coming out of a car. Your body is this high-performance machine that's always on, which means it's always producing this, acidic exhaust.
So to really understand how our two champions, the lungs and the kidneys, fight back, we first need to know the enemy. And it turns out the body is fighting on two totally different fronts against two very different kinds of acid. And this right here is the perfect place to start, the big picture. It really all boils down to a pretty simple division of labor. Some acids are going to be handled by the lungs, and everything else, that gets taken care of by the kidneys. So let's get into the details of each.
First up, we have what's called volatile acid. Now, volatile sounds complicated, but all it really means is that it can easily turn into a gas. And in our bodies, that gas is carbon dioxide, CO2. And what's the easiest way to get rid of a gas? You just breathe it out. Simple as that.
The other type is non-volatile or fixed acid. And these are called fixed because, they're basically stuck in your blood. They can't turn into a gas, so there's no way you can breathe them out. Your body needs a totally different system to get rid of them. And this is where our marathon runner, the kidneys, step up to the plate to filter them out.
And this is where you really start to see the big difference between them. Volatile acid, that's just a byproduct of your day-to-day metabolism. But these non-volatile acids, they tend to come from more specific situations, like your body breaking down protein after a meal, or from something more serious like hypoxia, which is when your tissues aren't getting enough oxygen.
And check this out. This really hammers home that sprinter versus marathon runner idea. For volatile acid, the lungs are on it in minutes. But for non-volatile acid, the kidneys can take hours or even days to get the job done. You can really see the two completely different strategies at play here.
Okay, and this is where it all gets super important in a hospital setting. If your lungs can't get rid of that volatile acid, you get something called respiratory acidosis. It's too much acid because of a breathing problem, often triggered by hypoventilation, just not breathing enough. But if the kidneys can't handle the non-volatile stuff, that causes metabolic acidosis. And this is often triggered by really serious conditions like shock, sepsis, or diabetic ketoacidosis, DKA.
So let's zoom in on our sprinter. How exactly do the lungs get this done so incredibly fast? It's actually a beautifully simple and, frankly, elegant system.
It's a pretty genius feedback loop, really. When there's too much CO2 in your blood, sensors in your body immediately tell your brain. And what's the brain's fix? Breathe faster, breathe deeper. You literally just blow off the extra CO2 and poof, the acid level drops almost instantly. Problem meet very quick solution.
All right, now let's check in on our marathon runner. The kidneys have a way more complex job. Because remember, these acids are fixed. They're stuck in the blood. You can't just breathe them away.
So what kind of stuff are we talking about here? Well, think about this. When you eat a big steak, your body makes sulfuric acid from the protein. If your tissues aren't getting enough oxygen, they start pumping out lactic acid. And in cases of uncontrolled diabetes, you get a huge buildup of things called keto acids.
So when these fixed acids start to build up, the kidneys basically have a two-step job. First, they have to physically filter that acid out of the blood and into urine. Second, and this is so important, they have to create a new substance called bicarbonate. You can think of bicarbonate as your body's own personal antacid. It floats around in your blood, neutralizing acid that hasn't been filtered out yet. It's a slow and methodical process, but it is absolutely vital.
Okay, so all this theory is one thing, right? But let's see how this all plays out where the stakes are highest, in the intensive care unit. This is where really understanding the difference between these two types of acid can literally be the difference between life and death. So let's imagine our first case, a patient with COPD, which is a lung disease that makes it really tough to breathe. They're hooked up to a ventilator to help them, but something's not right. This is a classic breathing problem.
See, the ventilator setting is off, so the patient is hypoventilating. They're not breathing enough. What happens, that CO2 or volatile acid starts to build up in the blood. The solution has absolutely nothing to do with the kidneys or their metabolism. The solution is to fix the breathing machine, the ventilator. It's a respiratory problem with a respiratory solution.
Okay, now let's flip the script completely. Our second patient is in septic shock, a really dangerous condition caused by a massive infection. Now, their breathing might look fast, but that's actually a symptom, not the root cause of their acid problem.
The real issue here is tissue hypoxia. Remember we talked about that? The patient's cells just aren't getting enough oxygen. So what do? They start producing tons and tons of lactic acid. That's a non-volatile acid, and it leads to this severe metabolic acidosis. And here is the absolute key takeaway. Look at the solution. It's to give fluids, give medications to support blood pressure, and give antibiotics to treat the infection. It has nothing to do with the ventilator. If you tried to fix this by messing with the ventilator settings, you'd be totally missing the point. You have to treat the metabolic cause.
That difference is everything. So when things are chaotic, in a high-pressure situation, how do you keep it all straight? How do you know if you're dealing with the sprinter or the marathon runner? Honestly, it all boils down to this one simple, powerful rule. If the problem acid can be breathed out, it's volatile, and that's a job for the lungs. If it has to be peed out, it's non-volatile, and that's a kidney or a metabolic problem. It is the clearest way to think about one of the most fundamental battles happening inside every single one of us,